Also, hello guys, hello everybody. Today we are going to have a short explanation, or actually a case study, of a woman who's 65 years old, coming to the pharmacy with a chronic pain, and she's been prescribed.
You said this was being prescribed tramadol.
Okay, tramadol is fine. Yeah, tramadol.
Okay.
It's a morphine. It's an opioid. Yeah.
Well, they're an opioid derivative, but
Yeah.
tell me, is she acute pain or chronic pain? It's a different approach.
Okay, let's do a chronic one. She has a chronic pain.
So it's chronic pain. So what type of counseling would you provide with her chronic pain with tramadol?
Okay, first of all, if she presents a prescription, okay, definitely I would consult her on this tramadol that's on the prescription, about side effects, about possible constipation, possible dizziness in the head as well, making sleepy. So to be able to, to have a problem, for instance, driving a car, and she feels like there is something wrong, she should basically, avoid driving. So that's what I would say. Directions for use. So most of the time it's 4 times a day. But as we discussed, it's not very good to tell them 4 times a day because it's not very precise. So we should describe it as in the morning before the breakfast or before going to work, lunchtime.
Tramadol would be a bit different because it's usually given as required.
Okay.
So depending on the level of pain that she has. So and actually, if it's chronic pain, it's a bit different than acute pain in that situation. But if it's chronic pain, she asks what type of pain does she have? Because there's different type of pain. There's neuropathic pain and there's receptive pain.
Yeah.
So does she have a broken arm, this one, or not?
Yeah, she has a broken arm now.
It's
Yeah.
a new pain. So she
Yes.
has chronic pain, but she has acute pain on top of chronic now. So let's just talk about the broken arm in a 65-year-old female,
Yeah.
which is more than likely at risk of osteoporosis anyway because of her age. So you give her tramadol at risk of falling because of the dizziness.
Yes.
That's another risk factor, and you provide the counseling around this one. I would provide the counseling as well about using anti-inflammatory agents because tramadol works on the brain basically. But if you have a broken arm, usually it's the inflammation that will cause the pain.
Yes.
So it might be appropriate for her to use over-the-counter ibuprofen to supplement the effect of tramadol.
Would you use rather diclofenac or ibuprofen?
Are you taking topical or taking?
I think I would go for topical over the counter.
Depends if she has a cast or not. If she has a cast, I would do for ibuprofen.
Yeah.
Diclofenac, it's a COX-2 inhibitor, so it has the advantage is increased bleeding over ibuprofen, which is not a COX-2 inhibitor. That's not specific to COX-2.
Yeah.
So I would, if you have a choice between the two, I would go for diclofenac. But the diclofenac usually if it's depending where the break is. If it's a wrist, it will probably good penetration, probably work well. If it's more in the middle of the arm, it will not make it to where the inflammation
The
is.
strength of the diclofenac over the counter is 25 milligrams. Do you think it's sufficient to maintain the pain? If the average, it should be 50 milligrams 3 times a day?
You can average take 2 tablets 3 times a day as well.
Okay.
So the risk that you have in this situation is really the risk of GI bleed, because elderly women are more at risk of GI bleed.
Yes.
So
And what is the age limit for the GI? Is it 50? Okay, because there was a guideline, I think a nice guideline, that if a patient is over 50 or something like that, you should recommend him a proton pump inhibitor or protection.
I think it's a bit older than that. I think it's more like 60s.
Yes.
And if you're female, older female are more likely than men to have GI bleed. So you could probably recommend a proton pump inhibitor. The other thing I would recommend, to be honest, is vitamin C. Because there's some data that shows that vitamin C supplementation decreases the risk of developing chronic pain, and it's called chronic regional pain syndrome, when you have a broken extremity. So that would be 500 milligrams twice a day for 6 weeks. That's what the recommendation
Obviously, we should ask her as well about any kind of diseases. So
that's basic thing. The first thing you should be asking, are you taking any other medication? What are the conditions that you have? Because that will guide your therapy.
So what about, for instance, if this patient is suffering from the high blood pressure, and we recommended her diclofenac? Is it a problem?
Well, I would not recommend diclofenac.
Yeah, because of the intracranial hypertension.
Because it would increase the blood pressure for sure. That we recommend paracetamol in that situation.
And that's it, basically. Nothing else. And what about using a topical diclofenac or ibuprofen for the patients who are suffering from high blood pressure?
Well, first of all, it has much less absorption, so you can use it fairly safely.
Yeah.
Again, it depends where the pain is, what type of pain that you have. So if it's neuropathic pain, diclofenac is not going to work. It has to be something like gabapentin or some kind of something works on the nerve. If it's monocytic pain, basically broken bone, broken or a smashed muscle, then anti-inflammatory would work. Then you can do topical.
So we would have like few scenarios. We have a lady who is taking tramadol for the chronic pain, and she has a broken arm, and then she wants something additional. So in this case, obviously, we could give her topical, but if it's possible to get somewhere close to the place where it's broken, we can give her oral tablets if she's not suffering from any other diseases like asthma or high blood pressure. So that's absolutely fine, and give her consulting on taking tramadol basically, and the side effects like constipation, dizziness, and fall reduction. Yeah.
And then next time we're going to talk about what we can do for chronic pain on its own.
Okay.
Focus on acute pain. But don't forget the vitamin C for preventing chronic pain.
That's a good one, because vitamin C in Poland is only considered for immune system, but I show the studies that basically doesn't work for this, I'm afraid.
Correct. But
So just an upsell.
well, but you can recommend it for broken bone, which is kind of weird to prevent. There's some data. It's not very strong data, but there's no risk of taking vitamin C, and it prevents having chronic pain from the broken bones that you have.
That's good. Thank you very much.
Okay.